In effective acupuncture treatment, making the correct energy diagnosis is half the battle won. This will ensure an appropriate effort to bring about balance, but it is only half the effort. The rest of the success of the treatment depends on choosing the best points, the correct needling maneuvers, and the necessary extraordinary therapies to carry out the therapy. The better we master these techniques, the more effective our single treatments will become. It is therefore worth spending some time and energy to learn about this. Acupuncture is a doing medicine. No matter how eloquent our choice of words and the explanations of the symptoms and illnesses of the patients, it is finally what we do with our needles on the patient that works. Patients cooperate by making changes to their diet and lifestyle according to the energy balance we're trying to achieve. We have to give clear messages to the body with our needles, the manipulation of these needles, the choice of points to needle, and selection of extraordinary therapies such as moxibustion, cupping, electrical stimulation of needles, and plum blossom needle tapping therapy. If our message is clear, the energy flow will change accordingly. If the message is not clear, or if we try to achieve too many changes within a short time, the energy flow will be confused and scattered. Okay, according to the author, one of his colleagues phoned him on several occasions to consult about the problem patients. Once she called to ask about a particularly difficult case. So after listening to the problem, the author responded, "This seems to be a problem patient. Maybe you should sedate liver too." Then the one who was asking for help was answered, "I have already done that." Or maybe it was a deficiency. You could try tonifying liver 8. Okay, then she answered, "I have done that as well." "What do you mean? Did you tonify or sedate the liver?" "I did both at the same time. I thought one of them should work." Okay, so this is what the author meant by saying that we should give clear messages to the body. If you tonify and sedate an organ at the same time, what do you expect to happen? To which command should the body comply? The next thing to remember is not to stimulate many energy balancing points in the same treatment. It is not as we are setting up a circuit of events that would start occurring one after another soon after the first needle. We are changing something more deep and fundamental in the body energy, and this has to be done gradually and steadily, achieving little and maintaining that improvement, then achieving more on top of that one by one. Many practitioners try to do this by partly using needles and partly using herbal medicine. So the author mainly uses acupuncture, and some dietary and lifestyle changes were pertinent. After all, both herbal medicine and diet influence the deeper energies of the body. Now, let us take a look at the various needling techniques. Okay, so choice of needle. So it's between thin needles and thick needles. So thin needles are used for thin-skinned areas like the face, hands, and feet. Thin needles are used for tonification. They are used for cosmetic treatments and skin ailments like acne, cellulite, swart, psoriasis at local areas. Thick needles, on the other hand, are used for thick-skinned areas like the body, the arms, and legs, used for sedation technique. Thick needles with metal handles are used in extraordinary therapies like moxa. So hot needle, when a piece of moxa is attached to the handle of the needle and burned. Okay, so when you do EA, electrical stimulation of the needle, so the needle should be thick, and in paralysis as a local treatment.